Hi, everyone. I will discuss today about shame and what it leads to in the parent, how it's tied to AFCA, and what can we do about it. There will be a second part. There will be shame in the child and some of the strategies we can do to reduce shame. So shame is really connected to AFCA because aggression towards family members by children and youth is highly stigmatized. We often don't talk about it because there's a lot of parent blaming around it. We often respond with, what else can you do for your child? What have you not done? Here's what I do. And oftentimes, parents report not feeling understood by their natural supportive network, either their parents, siblings, friends. There's not a lot of understanding sometimes of what adoptive families may experience when they are raising children who are struggling with a lot of mental health needs, trauma, developmental needs, fetal alcohol spectrum disorder. And at some point, parents stop sharing. They stop sharing with the natural network out of judgment, and they become increasingly isolated with their difficulties. And what shame looks like, it looks like in the parent as isolation, feeling like the world's against them and not for them. It leads to silence and secrecy. And what we heard from professionals who are working with families who experience AFCA in other countries is they said AFCA will grow and shame will grow when there's secrecy around it. There's Brené Brown that we really like, who's a researcher and social worker, who said shame will thrive in secrecy, shame, and judgment. And shame cannot survive being spoken. So what we want is we want to discuss AFCA with our natural network of support, teach them about what it looks like in a family, and just increasing our social support. Feeling validated, feeling like it's not a parenting issue, it's a systemic issue. Quite often, it's an issue of having children who have very high needs and a community that doesn't necessarily understand and respond to their needs. To reduce shame, we will also want the parent to increase their self-control, and they'll have better self-control if they feel supported and they feel validated in their experience. Quite often, we have parents who feel like they're not living according to their own values. So they were picturing having a family where people get along, there's not a lot of screaming, there's respect. And usually that's their values, and that's what they teach their children. But because of their needs or their past experiences, then that leads to children who are not respectful, and who don't make them feel like they're good parents. So we want parents to feel like I'm a good parent. I'm doing my best. I'm supported. I have people who know that I'm a good parent, and I know what I'm doing. I have a plan, and they will start measuring their parental capacity by what they're doing rather than by the child's response or by the child's behavior. Often we have parents who will increase their ability to do relational gestures toward the child. So relational gestures, will have a whole video on it, but briefly, these are the little things that we do for children, like I bought you this treat, I made you a nice dinner that I think you'll like, having a little notes in their lunchbox, like a little compliment here and there. And they're just things that we do to, yeah, show that the child that we love them, but also to feel good about ourselves. Live like, yes, I'm a good parent. I can do these little things for my child. It makes me feel good as a parent to do it. So again, shame quite often will be increased when there's an interaction that doesn't go well with the child. So we also want the parent to feel like they are able to de-escalate, and if there's an escalation, they're able to at least have some self-control and sustain the storm. And that's done by having supporters. It's done by practicing those strategies that we're learning about and being able to live by them, and increasing your ability to respond well to those interactions, and also to repair the relationship after a difficult interaction more quickly. Sometimes, parents can stay mad for days or weeks at the time because the interaction was so difficult. So having the ability to recover more quickly and to be able to move on with the child and a positive relationship will help the parent feel like they're living according to their own values. I think every family that we met said, the safety is a big value to them. Living non-violently is one of their values as well. And having to be validated in those values and say, yes, it's hard to live by them when you have a child who's displaying AFCA, then it's validating and they feel like they are understood. They're not alone in this experience, and it's giving a name to their experience as well. So I'm hoping this video helps you understand how shame relates to AFCA, and it's also some practical strategies to know how can I reduce the shame when I experience AFCA, or for the families that you're supporting that are experiencing AFCA. Thank you.